The oppression of vulnerable populations. Women were confronted with picketers at abortion clinics and had to travel long distances to reach one. The morning after pill was not widely available. Most hospitals did not offer abortions, and abortions were prohibited in military hospitals. Amendments were passed that prohibited federal funding of abortions and that prohibited federal employees' health plans from financing. There was a large gap between the wages of men and women. Many women were not promoted to higher positions even with excellent job performance. The Family and Medical Leave Act in 1993 required employers to give 12 weeks of leave for a new baby or for an ill family member. Affirmative action allowed people of color and women to obtain jobs, education, and government contracts. Public resentment grew because of perception that white claimants were being denied positions and opportunities. Civil rights activists feared less people of color would be admitted to college and jobs if affirmative action was abandoned. Proposition 209 in California was passed in 1997 and forbade public universities from showing any preference to people of color in admissions. Because of this, minority enrollment decreased. It also caused enhanced educational programs for minorities and sparked conversations about admissions criteria of universities. In 1994, Proposition 187 was passed, which declared illegal aliens ineligible for medical, social, and educational services. Personal Responsibility and Work Opportunities Act of 1996 gave states the option of terminating legal immigrants from Medicaid. The national mood towards immigrants began to shift around 1997. The Spanish population in the U.S. was angered because many had once been immigrants. Congress restored SSI, Medicaid, and food stamps to immigrants by 1998. Welfare reform legislation restricted eligibility to SSI for children with behavioral disorders, decreased funding for meals of children and family daycare homes, cut reimbursements for summer food programs, and eliminated startup and expansion funding of the school breakfast program. The Adoption and Safe Families Act wanted to double the number of adoptions of children in foster care. It also stated that reunification need not be attempted if a child was subjected to aggravated circumstances. The Family Preservation Program promoted adoptions and reunification. Don't Ask, Don't Tell approach enacted in the military. Data from 1999 suggested that Don't Ask, Don't Tell did not reduce the number of dismissals of gays and lesbians from the military. The AIDS epidemic resurfaced and rates of infection began to rise again.